Hi, I am Dr. Lalitha, Urologist and Urogynecologist from Lalitha's Urogynecology Center. Today let's learn about some healthy bladder habits. So bladder, urinary bladder basically has two functions. One is to store urine, which is collected in the bladder continuously from the kidneys through ureters. The urine is collected in the bladder. The bladder has to store it at least for 3 to 4 hours till the bladder gets full and we get a sensation to empty. And the second function is to empty the bladder once it is full, the emptying function. So the bladder basically has two functions, storage and emptying. So some of the girls right from their school age, they develop a very unhealthy habit of not passing urine or not emptying their bladder when they get a sensation that the bladder is full. It's because of various reasons. It could be because they don't have a toilet in the access, or it is because the toilets are not clean. Especially it starts from the school age. The school going children, they usually do not like to use the toilets, which are very unhygienic in some of the schools, even some of the private schools, not just public schools. So they tend to take less water to avoid the need to go to the restroom. So taking less water can give rise to urinary tract infections, and even when they feel the bladder is full, they try to postpone to the maximum time possible. So slowly, gradually the bladder muscle gets stretched, and they, over a period of time, their bladder sensations decrease. Initially, we all feel the bladder is full when it is full. We feel a sensation that the bladder is full. But if we gradually suppress that bladder sensation, gradually we lose the bladder sensation. So these girls over a period of time may not even realize that their bladder is full. The bladder gets stretched. So later on, when they want to empty the bladder, since the bladder muscle is stretched, it loses its tone, it loses its contractility or the power to empty. So they may have the difficulty in emptying. Not only that, in order to avoid leaks, they strain, they contract the muscles or the sphincters, which are supposed to close the urinary tube, the urethra, to prevent leaks. So this muscle becomes tight and it remains tight throughout, and even when they want to pass urine, it doesn't relax. So these girls over a period of time, or young women, even working women, tend to have a tendency to do this, and especially the working women who are on a field job, they have a lot of difficulties, and so they try to postpone the need to pass urine. This over a period of time results in bladder dysfunction. It could be either inability to control, it can result in urgency or urgency incontinence, or in some women difficulty in passing urine or avoiding dysfunction. This can result in serious back pressure changes, sometimes in the kidneys. These changes are usually seen in women with neurological problems like strokes or spinal cord problems, but similar problems may be seen in women who have a habit of postponing the need to pass urine. This is called neurogenic bladder, avoiding dysfunction due to the poor habit of postponing the need to pass urine. So my advice to all the women out there is, please drink enough water and please empty your bladder at periodic intervals. Don't postpone the need to pass urine. This not only results in urinary tract infections, but can result in long-term problems in the bladder function, which can result in urinary incontinence or even urinary retention or voiding difficulties.